Hi, my name is Maya, and my group did our project on the pectorals and rotator cuff muscles. So to start, we wanted to kind of give some context with some shoulder anatomy. The big thing here is to look at the spine of the scapula. The supraspinatus muscle will have its origin above the spine of the scapula, and the infraspinatus muscle will have its origin below the spine of the scapula. The four rotator cuff muscles are subscapularis, teres minor, supraspinatus, and infraspinatus. So you can see pictures of those on the picture to the right. The first rotator cuff muscle I'm going to talk about is subscapularis. It is a one joint muscle. Its origin is in the subscapular fossa, and its insertion is on the lesser tubercle of the humerus. Its actions include immediately rotating and adducting the arm, so pulling the arm closer to the body, and helping to hold the humeral head in the glenoid cavity of the scapula. So this means that it would help stabilize the shoulder joint. Our target exercise for subscapularis is reverse lawnmower starter. So you want to attach a band somewhere above your head and just pull your arm down to the opposite pocket. Any exercise for this muscle would be any kind of internal rotation. Our next muscle is teres minor. It's also a one joint muscle. Its origin is from the lateral border of the scapula, and its insertion is on the greater tubercle of the humerus. Its actions include laterally rotating the arm and also helping to hold the humeral head in the glenoid cavity of the scapula again. Our target exercise for teres minor is banded straight arm pull downs. So you want to attach a band sort of in the same height as before and just hold the rest of your body steady and pull both arms straight down. Next, we have supraspinatus. So again, this is the muscle that originates above the spine of the scapula. This is also a one joint muscle. Its origin is in the supraspinatus fossa, and its insertion is on the greater tubercle of the humerus. And its action is that it initiates and assists deltoid in the abduction of the arm, so it helps pull the arm away from the body. And our target exercise for supraspinatus is face pulls. Again, you want to have the band attached somewhere up high, and you're just going to pull the band up to your forehead. Lastly, we have infraspinatus. So infraspinatus is below the spine of the scapula. Again, it's a one joint muscle. It originates in the infraspinatus fossa of the scapula and inserts on the greater tubercle of the humerus. It laterally rotates the arm, and again, it helps to hold the humeral head in the glenoid cavity of the scapula. Our target exercise for infraspinatus is external rotation. There are different variations to this. We did ours with a very light dumbbell. And you'll just want to lay on your side and keep your elbow tucked at your side and just rotate your arm down and then back up. All of the exercises for the rotator cuff muscles you want to do with very low weight because a lot of them are either to help rehab after an injury or just to prevent an injury. These aren't your typical like lifting exercises. Now moving on to the pectoral muscles. First, we have pectoralis major. This is the muscle you think of when you think of doing any exercise that's for your chest, like push-ups or bench press. It's a one joint muscle. Its origin, first, the clavicular head is the anterior surface of the medial half of the clavicle. The sternocostal head is the anterior surface of the sternum, superior 6 costal cartilages, and the aponeurosis of the external oblique muscle. And an aponeurosis is kind of just like a membrane attaching a muscle to the bone. For the insertion, it inserts on the lateral lip of the intertubercular groove of the humerus. In its actions, it adducts and immediately rotates the humerus, so it moves the humerus towards the midline of the body, and it also draws the scapula inferiorly or draws the scapula down. Next, we have pectoralis minor. This is deeper than pectoralis major, and it's not so typically thought of when you think of the chest muscles. It is a one joint muscle. Its origin is the third to the fifth ribs near their costal cartilages, and its insertion is the medial border and superior surface of the coracoid process of the scapula. And its actions are to stabilize the scapula by drawing it inferiorly and anteriorly. So it'll draw it down and forward. Target exercise for pectorals. First, we have body weight, and that is just push-ups. If you can't do normal push-ups, you can also do them on your knees or on an inclined bench. We have another bodyweight exercise, and that's scapular push-ups. These don't target the pectorals as directly, but they can also target the pectorals if you can't do normal push-ups. Next, to add some resistance, we have banded chest flies. So you want to attach the band somewhere behind you and just move your arms towards your midline. And lastly, for a weighted exercise, we have bench press. The bar path is very important for chest press, so you'll want to start down towards your sternum, and then the bar should end somewhere up towards your eye line. And lastly, we just wanted to say thank you to Kyle and Reagan for allowing us to use Carpenter Trout, and also to Dr. Lombardi for guidance throughout the project and coordination of facilities. And a lot of our information came from the University of Wisconsin Medicine Department of Radiology. So that's our images and our origin insertions, our actions, and thank you.